Good morning, everyone, and welcome to Basic Surgical Skills course. I'm Dr. Rajendra, and I'm one of the consultant obstetricians here in Derby, and my brief today is to talk to you about basic principles and the importance of anatomy in surgery. So next slide. So the key points I want to discuss today is the importance of anatomy, the different types of abdominal incisions, how wound healing is affected by this, and generic risks and complications of surgery. So when we look at this picture, we see that the surgery itself hasn't changed through the ages in fundamentally in its principles. You have a theatre team, you have a place to do the surgery. If you look at both, you have assistants. However, when you look at the screen on the top, more than 100 years ago, there was no revolutionary sepsis. Asepsis was not thought of. Wound infections and things would have been significant. There's no significant anesthesia. And when you look at the sterile, very calm environment of the current practice, you can see how changes have been effected through the ages. But the basic principles of surgery rely on some components of, and it's very important that before any surgery is undertaken, you understand why you're undertaking that particular surgery. So very much reliant on a very careful history and examination, understanding the signs and symptoms of concern, and corroborating that with the investigations that are relevant before you make a diagnosis, and therefore then proceeding to an indication of surgery being the answer to the concerns at hand. So what are the basic principles then of surgery? The most important requirements of surgery really are safety aspects. So you do need a team, as I've alluded to, a proper environment, which needs to be a sterile environment, the right equipment for the right procedure, asepsis, again, massively important. You need to be accessible, or the patients need, you need to position and exposure of the relevant organ that you're interested in terms of surgery needs to be accessible. And that a lot depends on positioning of the patient and the exposure of the blood that you're interested in. So when we look at surgery, there are certain never events. So the obvious one is obviously things like misplaced tubes or retained foreign body. But when you look at the top never events, actually wrong site surgery is fundamentally the most important. So hence, lots of things that need to come into place when you're considering that you really shouldn't be operating on somebody if you don't know why you're operating, what you're operating on, and principles like that. So when we talk about never events, that means things that should never happen in terms of safety reports, then wrong site surgery leads that with 142 out of 364 reported. Retained objects also surprisingly high. You'd think that all our checking and our rechecking should balance that, but again, unfortunately, it's fairly common. It's a top never event. Misplaced feeding tubes and wrong implants or prostheses being inserted also plays a part in that. So in order to assist or to reduce the risk of these non-never events, then there needs to be emphasis on safety and reducing those risks. So as you all know, we have the WHO safety checklist in order to reduce that. The safety checklist consists of, certain aspects. So you have a briefing, everybody gathers together so people understand what we're going to do and identify any issues that might be related to that list. You sign in when the patient comes in. so that you know what's being done. You confirm that we're all in agreement with the proposed procedure. There were any concerns that can be raised when the patient leaves, signing out, and a general debrief at the end of the list to see what went well, identifying any factors that need correcting. When we go on to anatomy, why is anatomy important for surgery? Well, the main function really of the abdominal wall, and like I said, I'm going to concentrate on the abdominal wall here because that's where as obstetricians and gynecologists we're interested in. But the main function of an abdominal wall is really it covers the organs, it protects them, it maintains the position of the organs, and obviously when we talk about things like symptomatic prolapses and stuff, or bladder dysfunction, then it has a role in the pressure balance to affect functioning of valves. This is really just to say that we all need to understand the appropriateness of anatomy. It's not just about, let's just take it out and see what happens. It is much more of a precise skill. The abdominal wall. So I'm not going to go through a whole lecture of anatomy of the abdominal wall, but just to understand really that this is important because it is important about where you're going into, where you're going to be incising, understanding the nervous system that connects these because your incisions or your surgery might affect that. Understanding the layers that you need to come through to get to the organ of interest. So, for example, when we are doing obstetric cases, for example, cesarean sections, we're interested in the lower part of the pelvis, where the rectus sheath lies, and at that stage, the rectus sheath actually enfolds the rectus abdominal muscle. And lies, sorry, the rectus abdominal muscle, as you can see, and the rectus abdominis, which is the aponeurosis of the transverse abdominal internal, external oblique, and the transverse abdominal muscles will actually lie above the rectus sheath, the rectus muscles. So you have to go through that to get into the peritoneum, whereas further up, above the arcuate line, it is enclosed because the aponeurosis splits to enclose the longitudinal muscles. Now, it is important that we understand where the major vessels lie because they would interfere with our incision planning. You don't want to have major bleeds because you've gone with no understanding of major vessel routes. But similarly, nerve distribution is also important when determining your surgical procedure. There are various different incisions that are used, and they all have different names. It's important to understand them because it's important that the incisions are specific to the type of operation you want, and it's designed to be as close to the organ of interest to give you as good exposure as possible and affect what you are trying to achieve from that procedure. So, for example, we are very used to, in cesarean sections, doing a lower transverse abdominal incision, generally a phalansteal incision or a jaw chordal incision. But the important thing is it goes along the dermatomes. If you cut that open, you expose the uterus very well, and you actually effect delivery of the fetus, again, simply. Now, in major gynecological procedures, you might use that incision, the lower transverse incision, if you've got a uterus that you need to take out, but you might want to resort to a midline incision if it's a large uterus, or you're suspecting malignancy where you need to maybe explore the other adjacent organs as well. And you might want to make sure that your incision allows you to extend it or to get easy access to other tissues that might be of interest. Types of incisions also depending on, when you're making a choice of what type of incision, you need to understand the benefits and the limitations of each type of incision in that decision making. So the ideal incision obviously needs to have access to the interested organ. It should be extendable if required. Its muscles heal better if it's split rather than cut. And you need to think about healing afterwards as well. And then aesthetically, you want to try and have an incision that is most likely to produce minimal scarring. Now, wound healing itself is a rather complex series of processes which involve platelets, inflammatory cell reactions, and the cytokines. And I'm not going to go through this in detail. If you're interested, you can read up about it. But it's important to understand that certain things actually limit or affect wound healing processes. Okay, so the risk and complications and factors that can affect surgery and influence surgery, obviously the BMI, smoking, other comorbid factors, because they are going to have direct effect on how well a patient heals, and also affect complications that possibly can arise from that. For example, a lady with a large BMI may complicate the process. A large BMI can complicate surgery because access might be very difficult. They have a higher risk of, therefore, they can have a high risk of bleeding because you can't get access adequately. That increases the risk of accidental damage to surrounding organs or structures. But also in terms of the healing process, you're more likely to get a wound hematoma or therefore infection and delayed healing because of that. And other things that can affect healing and increase the risk of complications, obviously, is states of immunosuppression, malignancy, certainly can influence that. Intraoperatively, additionally, you need to think about bleeding as a major cause of major risk and complication, which can then influence injury to adjacent structures. For example, if somebody who's had more than one cesarean section, then the risk of bladder injury becomes more relevant. And when you have these complications, then you increase operating time. When operating time is increased, then the other complications then can have a knock-on effect. So, for example, increased operating time increases the risk of a VTE post-surgery. In the medium term, post-operatively, you need to think very carefully about infections and hematoma. Wound dehiscence is also an important issue because they all go together. Wound infection increases the risk of wound hematoma, wound dehiscence, and VTE risk, as I've alluded to before. In the longer term, you need to think about surgery can complicate healing because it can cause hernias, fistulas, chronic pain. Certainly, repeat operations can give rise to chronic pain from adhesions and generalized scarring. So in summary, I think it's important that in order to achieve success in surgery, you need to have the right procedure for the condition that you're treating. Appropriate knowledge of anatomy is essential. The right equipment and the right team surrounding to treat the patient, and obviously the importance of post-operative care when you're looking at complications. Thank you very much. any questions that you have. I'm sure the team should be able to answer. If not, I'll be happy to answer them. Obviously, I'm not able to answer them directly, but I shall endeavour to respond to any obvious questions. Thank you